So similarly, I think we started this sort of concept around the same time, with a very similar set of questions. In Chicago, 1 in 3 Chicagoans doesn't have access to the computer from home, and we also have a significant number of Chicagoans are living under the poverty line. That distribution in terms of internet access, in terms of 1 in 3, isn't equally distributed over the city, so that we have areas of the city where broadband at home is as low as 20 or 30% of the people in a given community. So even though the average is 1 in 3, certain neighborhoods it's much lower than that. Our real simple goal with this, it was a combination of improving access at home after hours, so that we're beyond just the 2 hours we can do at the library, in order for people to practice skills. So we provided both the concept of lending the hotspots, plus additional devices like laptops. Each of the locations where we've piloted this program, we've also added additional wraparound services for digital skills and coaching. And what specifically we're looking for is a combination of changed attitudes and behaviors around broadband at home. And specifically, we're interested in changing or impacting broadband adoption rates at home as a result of people taking the technology home, experimenting with it, and for those who find, after playing and experimenting with it, that there is actually value. Our hope is that we can help expose them to low-cost or free programs where they can more permanently become connected at home. So our goal is not to be the ongoing free provider at home. It's more about providing a prolonged experience with the goal of future adoption. So just to give you a sense, so we placed these in communities that had broadband adoption rates that were between 40 and 65% relative, or actually less than 65% broadband adoption at home. The way that it's structured is the borrowing is for 3 weeks, so similar to other materials, with the option to renew, and it's a laptop and a hotspot. What we found in general is that, so just a few statistics on the people who've used the program so far in terms of the demographics, and what we've learned is, first of all, there's really high demand for it, so people are in these targeted communities really are wanting the service and bringing it home, which we thought was good. We also, because we restricted the checking out of the item to the specific locations in the communities with low broadband adoption rates, what we were hoping and what we found is that we mapped the checking out of these items, and they're hyper localized, so the hotspots are actually staying within the communities that are checking them out, which we think is a good thing. We thought one of the interesting statistics is that 11% of those who are checking out the hotspots now, by our recent numbers, 11% didn't currently have a library card, so that's a new user base that, as a result of the program. 63% of those who have checked out a hotspot have kids in the home. A little more than half of the folks who are checking them out are one adult in the household. So it's a combination of just one adult plus kids. We also thought it was interesting that, and part of this is just where we're doing the lending program. 70% of our folks who are using the program live in multi-use, multi-family, multiplex living, so apartments and housing development projects, a very small percentage are single-family homes. 30% of the folks who are using the program are under the U.S. poverty rate, and 60% are below $49,000 a year. About half of the people that are using the program are employed, and what we also thought was interesting in terms of some of the surveying that we've done with the folks, in addition to just the demographic analysis, is that 55% of those who have participated in the program report that they're likely or very likely to, they would be likely or very likely to pay $20 or less for broadband at home. So we think, we're early in the program, but we think those are really interesting numbers. I know we actually, talked the other day about what are the kinds of programs that how could we take it to the next step with some of these individuals in terms of bringing greater visibility to free or low-cost programs as they're returning the hotspots. What we found during the whole revitalization of healthcare, many libraries, and we were one of them, doubled down on essentially sort of mentors or people who worked in our libraries to help people apply for healthcare. And so now we're kind of wondering, so is that sort of the next evolution, is that for those who are interested in having permanent connectivity at home, willing to pay $20 or less, and there's programs that are more like $10, that there seems that there could be an interesting opportunity to help make some of those conversions right at the home branch.